Medical misinformation is everywhere. Dr. Mitch is here for straight talk and to give you the truth.
What if I told you that cholesterol is not the real cause of heart attacks? You've probably not been told the truth. The real culprits are basically lurking in your blood: inflammation, toxic metals, and their hidden risks. Your millions are put on cholesterol-lowering drugs that fail to address the real root causes of heart attacks and strokes, and they have serious side effects. And I'm not just saying this, there are tons of articles to support that. The truth: your risk probably has nothing to do with cholesterol alone. It's driven by inflammation, clotting of the blood, oxidation, and toxic metal buildup. And if you don't know the real risk factors, you're flying totally blind in this. Today, I'm going to basically show you exactly what tests you should do, why toxic metals are silently destroying your cardiovascular system. Now, for decades, we've been told that high cholesterol is the enemy. But here's the real shocking truth. Half of all heart attack victims have normal cholesterol. That's right. You can look up the studies. I have. And if cholesterol was the main cause, that wouldn't be possible. The real question is, what is causing heart attack? Now, let's break it down. There's a test called Lp(a). It is a silent killer. Lipoprotein(a) is a genetic marker of cholesterol that makes it extra sticky, like Velcro in your arteries, and it drives plaque buildup in clots. Yet, most doctors never look for it. Apolipoprotein B is a particle that makes cholesterol also meaningless. What it is, it's actually a protein fraction of the LDL, the supposed bad particle. The more particles, the more risk. C-reactive protein, high sensitive, and homocysteine. Inflammation, again, underscores how much probability you have of having a problem. And homocysteine can also increase significantly your risk of a heart attack more than cholesterol ever could. Now, oxidized LDL, that is a real problem. When LDL is oxidized, it can trigger heart attacks. It makes a special cell called a foam cell, which can fuel plaquing and rupture. But look also at the fibrinogen. It's a clot risk factor that very few know about. Fibrinogen means hyperviscous, thicker blood and risk of deadly clots. An extremely important test called a Lp(a)2 or plaque 2 is basically predicts unstable plaque. You may not have a lot of plaque in your arteries that everyone says, but if it's unstable and it could break off, you can get caught in a smaller artery that can cause a stroke or a heart attack. Cardiologists often ignore heavy metals. Why? I don't know, because it was a cardiologist that did what's called the TAC2 trial. And vasotoxic lead, arsenic, arsenic and lead and cadmium, they do increase heart attack risk significantly. Cadmium found in pollution and cigarettes is an artery destroyer. Mercury disrupts nitric oxide. It damages your vessels. And the worst part, these metals, they accumulate over time. You could have the accumulation since you were a kid, and they silently poison that cardiovascular system. Have you ever had them checked? Have you ever looked at them, ever go beyond and check all these other missing pieces, which are obviously critical warning signs that can predict your true risk? Yeah, that's what I thought. The good news is you can lower your risk naturally. In addition to eating whole, dense, nutrient foods, there are clinically researched nutraceuticals that can fight cardiovascular health, fight inflammation, and detox these metals. Well, don't wait until it's too late. Get tested. Get the real risk factors, not just cholesterol.